Hey everybody, we're hosting a doctor series and we're actually hosting it on camera today in person, and I'm so excited because my favorite person is here today, Dr. Jacci, and she's an OMF surgeon from Cleveland, Ohio, and so she's come all this way to let me interview her. So thank you, Dr. Jacci, for coming on.
Thank you for having me.
Yes,
I'm very excited to be here.
I'm so happy you're here. And so my first question is, what is an OMF surgeon for anyone who doesn't actually know what that is?
Sure, absolutely. So OMF stands for oral and maxillofacial surgeon, or oral and maxillofacial surgery. So many people kind of don't know what that is. And so an oral and maxillofacial surgeon, as specialists, we call ourselves or consider ourselves specialists in anything in that region, like above the clavicles or above the shoulders, in the head, neck, oral cavity, the facial skeleton, basically jaw and reconstructive surgery. So we treat a number of different disease processes and just trauma and all kinds of different things in the facial region. Sometimes I kind of refer to us as orthopedists of the skull. So because we fix the facial bones just like orthopedic surgeons fix the long bones or any other bone in the body, really. So we kind of have a lot of the same principles as orthopedic surgeons. We just have a lot smaller plates and screws, as I like to say. But as an oral and maxillofacial surgeon, so I can treat anything from significant facial trauma, from like a car accident, to just a simple like tooth abscess or pulling a tooth.
Yeah, and so it sounds like for something like that, you would have to go to a lot of schooling. So tell me more about like what was involved in that to actually, become this type of a surgeon.
Schooling is a big part of it, as you can imagine. So we're very, very unique. So to become an oral maxillofacial surgeon, I started out obviously with undergraduate and then went to dental school. So I completed dental school first. And oral maxillofacial surgery is technically or more commonly or more traditionally a dental specialty. So from dental school, that's when I decided to become an oral and maxillofacial surgeon. And as part of my residency training, I also then got accepted into medical school. So then I went to medical school. And then after completing medical school and kind of like alongside medical school, I was completing and did complete my oral maxillofacial surgery residency. So if you're looking at that in a timeline, just dental school is 4 years, and then medical school and residency was 6 years. So that's 10 years minimum, on top of undergraduate, obviously, and any other fellowships, because we have fellowships as well that you can, go into after you complete residency as well. So.
Wow, that's a lot of schooling.
It is a lot of schooling. It's funny when I talk about it because, like, looking back at it, it didn't feel like it was that long. Like, when I do the numbers, it was like 15, 16 years that I was, like, either in school or training or something like that. But it didn't feel that way.
And so how did it feel when you finally became a surgeon after all
I
of
was
that?
like, I didn't believe it. I was looking for other things to do. I'm like, I'm not ready. After 15 years, I was like, I don't think I'm ready. It is kind of surreal. Because you train for so long and you get in this mindset and you're just so used to what it is to be in that environment, in a training environment, in a resident environment. Mm-hmm. Sometimes it is kind of hard to wrap your mind around, that next step. So it was exciting and scary all at the same time.
That's amazing. And so in terms of also like being, a female in this field, I know we've spoken before about how there aren't too many females actually like in this field and specialty. Why is that and how small is that really?
There's a lot of numbers. So my society is the American Academy of Oral and Maxillofacial Surgery, AMS as we call it for short, which actually is right down the road in Chicago here, because it seems like every medical society, any society seems to be like based in Chicago. But so they put out numbers and every year, and I think the most recent, it's been anywhere between like 8% of oral maxillofacial surgeons are female up to almost 20, something like that. I'm not really sure of the exact numbers, and I'm sure sometimes it's underestimated, but obviously we are definitely a minority in our specialty. And I think that's just because with a lot of not only medical or healthcare specialties, but with a lot of jobs, 50, 60 years ago, the female's role was to be at home, and they were the caremaker and the homemaker. And obviously that's changed, and women are career women. I mean, I grew up, my mother was a full-time career woman, and so was my father. So they both had full-time jobs. So for me, it was never really a question of getting a career or having a career, because that was my role model. My mother was my role model. And so I saw her work and be very successful at it. So that was, of course, what I was going to do. But that's what oral surgery, is like. So when it first started, it was just all males. And then, as time went on, it grew and evolved with every other, society out there, and realized that, they should welcome women. And so now there's definitely more and more women entering the field. It is a very rigorous field too. So like I said, so for someone, for instance, that's going to dental school, it's 4 years. And dental school is different from medical school in the fact that when you go to medical school, you have to do a residency in order to practice whatever specialty you choose. So medical school is 4 years as well. And then the minimum medical residency is 3 years. So for dental school, you can go to dental school for 4 years and then open the next day, walk down the street, open your door, and be a practicing dentist. So the kind of time that's dedicated to being a dentist versus being a medical doctor, is different. So when you're thinking about becoming an oral surgeon out of dental school, that's an additional 4 to 6 years. And I chose the longest route, which was the 6-year route. So that's was always a drawback for many women as well, for women who want to have families, and and part of it was discouraged as well. But now again, everything evolves, and it's supported to have families during residency, and have children. That's not really deterrent anymore. But that was why in the beginning you didn't see a lot of females, and now it's definitely, like I said, it's more accepted. I mean, I am on the staff of a oral surgery residency program in Cleveland with Case Western Reserve. So I participate in the interviewing every year of candidates for our program, which is always fun. I really enjoy that. And this past year, there was just as many female applicants that we interviewed as male applicants. So that's really exciting. So it's definitely changing for the better. I know you and I have talked about this before. I personally don't think like a goal of oral surgery is to have 50% men and 50% women, because I just don't really think that's like a realistic benchmark, or that's not really going to necessarily grow the specialty. I just definitely advocate for, just being an open specialty, that when you think of us, you think of, this is a specialty that both men and women can, succeed in. It's not just a male specific specialty anymore.
Absolutely. And I know you're very passionate about like being a mentor to anybody who's interested in this field, and especially like women, of course. And so what would you say to maybe, a younger woman who's, thinking about approaching this type of career? Like, how would you give some words of encouragement there?
Sure. I do mentor a lot of students back home in Cleveland. So that is very passionate thing that I like to do. And I just tell all of them, the first thing that you have to decide is if this is what you really want to do, because you have to like it, no matter if you're male, female, or anything else. If you, whatever you do, you have to like it. If you don't like it and you don't enjoy what you're doing and you don't enjoy what you're learning, because you learn a lot. I mean, so obviously residency training is a whole learning process, but medicine in general is lifelong learning, we like to say. So if you don't enjoy it, then this isn't for you, no matter if you're male or female. So that's what I tell everybody first. Say, is this something that you really like to do? Are you passionate about this? Can you see yourself doing this? And if you can definitely say, yes, I want to do this, then I encourage everybody, there's no limitation, of course you should apply, don't think about what other people say. I tell a lot of people, like, there's always going to be those naysayers out there for whatever reason. And, they want to discourage people, especially women sometimes, but just just move on from those people. Those are the people that you, what they say goes in one ear and out the other, because they're not, for whatever reason, going to be supportive of you. Find the people that are, because there's so many people that are. And most of the program directors and most of the programs out there, they seek females applicants. They seek the best applicants, not just, female or male, but they want the best applicants. And it's no longer, has to be a certain gender. So I encourage everybody to pursue it, and don't let the time commitment, kind of be a deterrent, because it's really not. It goes by in like a flash. I mean, I know that sounds crazy, but anybody in medicine, I'm sure, can relate to that. Like residency, when you start, you're like, oh my gosh, 3, 4, 7 years. And then you blink your eye and it's over.
That's amazing. And I feel like that's great that you're just so passionate about, being a mentor and supporting, men or women, but specifically women to, kind of put themselves out there. Have you felt, you mentioned your mom was really like your role model, and she was always like working growing up, and it wasn't as common, back then probably. I know for me, my mom worked, and it wasn't common actually at all where I grew up. But I will say, how is she your mentor? Like, what do you feel that she's, taught you that's kind of you bring with you every day?
Oh, my grit. My mom is I just watched her. So my mother was an educator, so she was in education. So my mom, grew up in like the 60s, 70s. And at that time, I mean, she's told me this, at that time, as a female, if you went to college, you either went to college to be a teacher or you went to college to be a nurse. Those were like, the two main career paths. So she chose the education path, and she started as a home economics teacher. And then she had my brother and I have one younger brother, and she took 2 years off. And then when she went back, she decided that she was going to further get more administrative certificates. So she became an administrator, and then she got her master's, and then she ultimately became a principal. So, and I just saw her, I mean, she was tough. I mean, she had to deal with a lot of, as a principal, as a leader, obviously you have a lot of responsibility on your shoulders, and you have a lot of people that are going to like you, and you have also a lot of people that are not going to like you. And I saw her, deal with that. It's funny now as adults, as we're both, adults now, and we talk. I mean, she tells me a little bit more about, this, you didn't know this because we didn't, want you kids to know how hard it was. But, I really had struggled with some people at work, clashes with personalities and different things, and different things that she had to do that she wasn't like happy about, that she was kind of like forced to do, like not in a bad way, but to get to a goal, well, you have to interview for this job to get this job. It didn't make sense, but she had to do it. So, but anyways, like I said, I just looked up to her, and I mean, she was there for me. It was never like a situation where I came home and like, I never saw my parents, or I never saw my mom, even though she worked full time. So,
right.
She just had grit, and she gave it to me. And she also just gave me the motivation. Like I said, it never crossed my mind that I was not going to go to college and, make a career for myself. I didn't ever know what it was right away, but, it definitely, because of her, that was what I wanted to do.
And then you finally made your way back to Ohio. So how did that feel when that finally happened? Because we didn't kind of talk about that journey, because you weren't always, obviously working out of your home state.
Correct. It felt good. First of all, to answer your question, it felt great to be back. And I came back when I was ready. It took 18 years, but after 18 years, I was ready to come back to Cleveland. I wanted to get out when I graduated college. So I went to college in Cleveland. And then when I graduated college, and that's when I went into dental school, I was ready to like spread my wings. So that's when I went to Boston University, got to live in the city. That was a big goal of mine. And then again, just residency, deciding to pursue oral surgery. The whole process is like a matching process. So you interview, and then you're rank these places, and then match day is like the big reveal. You get to see where you're going for the next 6 years of your life. And for me, that was Detroit. So for many years, kind of like my education kind of dictated where I was going and my different training and jobs. So, and I loved it. And for me, it was what I needed. I really, really cherish all the life experience that I learned learned and gained from living in a lot of different cities and meeting so many different people along the way. I feel like I really gained both education for my career, but also just life experiences. So, but after being away for 18 years, it's been fun to be back home. And there is something to be said about being able to contribute to your community that you grew up with. You know, when I talk to patients and I'm like, oh, where are you from? Oh, or what high school did you go to? I see a lot of patients who went to the same undergraduate university that I went to because it's in Cleveland. So it's close by. So that's fun. And I have a lot of family members, and my entire extended family is in Cleveland. So usually at least once a week, there's somebody who knows one of my family members. So, that's been really fun. And it feels just so much more kind of impactful to be able to give back to your community in some way.
Absolutely. And in terms of just, actually your day-to-day when you are, in OR, like what is your day-to-day? Is every day different?
So every day is a little bit different. You never know what's gonna walk through the door. But so my days as an oral surgeon, so I work 5 days a week, which is kind of, to some oral surgeons, that would be like unheard of, because a lot of oral surgeons, a full work week is 3.5 to 4 days a week, which I would like to achieve one day, which I can achieve one day when I'm ready. But right now I do work 5 days a week in some capacity. So a lot of my time is spent in the outpatient office setting, clinic setting. So I see patients in clinic for consultations, minor procedures, outpatient clinic procedures, as well as like follow-ups and different things. And then, for the consultations, we basically decide whether or not these surgeries are outpatient office surgeries or if they have to go to the hospital, and then those are scheduled. So on average, I'm probably in the operating room at least one day a week. And then one day a week, I'm also, like I mentioned, I work with the residency program in Cleveland, Case Western Reserve University residency program. So that's been a really great experience for me. I really enjoy that. I never really thought that I would like, quote unquote, teaching. I never really thought that I was a great teacher. I still really don't, but I do feel that, it also makes me feel good to be able to help other people. I know I can still remember, it hasn't been that long, what it was like to be in their shoes. And you're just kind of like a deer in the headlights sometimes. You don't know what's going on. And you really get thrown to the fire. So it's nice to kind of be there for support and see these kids. They're not really kids, but these kids like grow over the course of like 4 or 5, 6 years.
That's amazing. Any interesting stories to share about your kind of, I would say, interesting life that you have and career?
I mean, there's always interesting stories. I mean, residency in and of itself was just a interesting time in life. I mean, I look back and I don't even know how I even survived it, because we would work, and the restrictions and different things have changed even since I graduated residency. So there's hours restrictions and different things like that. But we would work like 30 hours straight, and sometimes that would be not sleeping. If it was a really busy night, we wouldn't sleep. We'd be up all night, and then, then we'd go home and we just like crash for, all day. But then you get up 4 or 5 hours later and just be ready to do it all over again. I just remember, going out all night sometimes, both for work purposes and for fun purposes too. So Detroit was a fun place to train, definitely. I mean, I just remember some of the nights in the trauma bays, in, inner city Detroit. And I mean, some of the traumas that would come in literally started outside the door of the hospital.
Oh, wow.
And they would just come into, and then they would continue, because like, someone would get injured and then someone else was, coming in, which is, you can kind of laugh about it, but, sometimes that is a little bit scary. But yeah, some of the stuff it's the adrenaline that you get when you're in that situation is like nothing that I can explain.
Okay.
Like, it's kind of like riding a roller coaster because you don't really have time to think. You're just like doing. And then you look back and you're like, oh my gosh, I did that. And so to me, that was always a really big honor because not many people get to, have that experience as a surgeon, as a doctor, to help people in that way when they're so vulnerable in a trauma situation. So that was always fun. I mean, and now I see traumas and I see a lot of trauma, but it's in a different capacity because, that's kind of like when you're a resident, then when you become an attending as it kind of like progresses along, you're not the ones necessarily, unless you're emergency room attending, you're not the ones like in the trenches, as we say, by the time I see them, they've been stabilized and they just have like their face like smashed in. And believe it or not, people can sit there with their face smashed in and not really be in too much discomfort. So,
but then you fix it.
But then we fix it, yes, and that's where the fun begins. And I fix it.
That's amazing. Well, this has been great. I'm so happy that you were able to come out today and do the interview. If we want to find out more about you, I know you're super popular on Instagram. So why don't you tell us where we can find you?
Of course, yes. Instagram has kind of been my social media passion. So it's at Dr. Jackie, and to spell out doctor. So DOCTOR Jackie, and that's JCCI, because that's how my mother spelled it. So, but that's the main place to find me online.
And then she also has a website too. So we'll throw that up.
Yes, thank you.
Thanks so much for watching.